Well, there will be a parade tomorrow for this year's NBA champions, the Boston Celtics. We give our heroes parades. In the early days of space travel, we gave astronauts parades. But then we shot so many astronauts into space and even to the moon that we stopped giving them parades. We took space travel for granted. It was no longer the stuff of heroism. Our most important heroes have always been taken for granted. They never get parades. I'm talking about the people who do the most important work a human being can do. They save lives. There is no higher calling than saving lives. Some of you might know what it feels like, but most of us don't. Most of us have never and will never save a life, not one. We won't drag a wounded soldier off a battlefield. We won't drive a dying person to an emergency room just in time. We won't pull that drowning child out of the water. And we won't treat patients in hospitals who would die without our medical expertise. Not every doctor and nurse saves lives. Some areas of medicine do not involve life and death. Some doctors occasionally save lives. And then there is Dr. Anthony Fauci. He has had the experience as an attending physician of saving the life of a patient in his care, and in his 54 years at the National Institute of Health, fighting every infectious disease that emerged in those 54 years and saving lives. Dr. Fauci's work has saved millions upon millions of lives.
Who are the heroes who are there in American life today? Who are the ones that you would point out to young Americans as figures who should inspire this country?
I think of Dr. Fauci. Probably never heard of him. Well, you did. Ann heard him. He's a very fine research, top doctor at National Institute of Health, working hard, doing something about research on this disease of AIDS.
After years of the research and clinical struggle with HIV/AIDS, Dr. Fauci's work helped us get to the medical breakthroughs that meant AIDS was no longer a death sentence. And he did not believe that his moral responsibility as a physician and public health official stopped at the border. He convinced Republican President George W. Bush to fully fund a massive AIDS intervention project in Africa that was called the President's Emergency Plan for AIDS Relief, PEPFAR. PEPFAR was the largest global health initiative for a single disease by any country in history. That was Dr. Anthony Fauci's work. And that program saved over 25 million lives. The work was never easy.
I hate to use the word gay in connection with sodomy. There's nothing gay about these people engaging in incredibly offensive and revolting conduct that has led to the proliferation of AIDS.
There is a feeling among members of any of a number of professions or just the general population that patients with AIDS, many of whom are homosexual, are a little bit different. I think that that has led to a little bit of a complacency about the approach towards this disease.
Dr. Fauci has always had to deal with harsh critics of his work and attacks on him personally, really nasty attacks. When some AIDS research activists were dissatisfied, understandably, since they were dying, dissatisfied with the medical progress in treating AIDS, they called Dr. Fauci a murderer. The playwright, the acclaimed playwright, Larry Kramer, called Dr. Fauci a murderer more than once. Dr. Fauci's reaction to those attacks was to invite the people who were attacking him and calling him a murderer into his office to hear their complaints. He went to Greenwich Village to meetings to hear their complaints. He went to San Francisco to speak to those people in the streets to hear their complaints. Some of those protesters who called Dr. Fauci a murderer eventually became his best friends. Dr. Fauci's work enabled Larry Kramer, who was HIV positive, to live to the age of 84. And their last words to each other, and what were the last weeks of Larry Kramer's life were, Larry saying, "I love you, Tony," and I tearfully responded, "I love you too, Larry." That story is told in Anthony Fauci's powerful, hugely informative, and deeply emotional new book, On Call, A Doctor's Journey in Public Service. Anthony Fauci was used to curing patients with infectious diseases. Then came AIDS. He filled the National Institute of Health with as many beds as possible to serve AIDS patients directly and to treat them directly himself. And for the first time in his medical career, he was not a lifesaver. He could not be a lifesaver. He did not have the tools. He did not have the medicines. He was helplessly watching his patients die. Ron had gone completely blind. The cytomegalovirus, despite treatment that was obviously inadequate, had literally chewed up the critical sight elements of his retina from the time we had made morning rounds to the time we walked into the room that evening. I constrained my emotions as Cliff and I comforted him about his devastating outcome, although he said to us he expected that this would happen because he had been gradually losing vision over the previous weeks. We left and finished our rounds. I went back to my office around the corner and down the hall from the patient ward, just out of sight of my team, and burst into tears. I was not just deeply shaken and saddened, I was profoundly frustrated and angry. Ron would soon die. This is just one such story. When all of the rest of us and everyone in the world were waiting for a COVID vaccine, we did not have to wait as long as AIDS patients had to wait for relief. Thanks to the years, decades of research on vaccines and infectious diseases that Anthony Fauci and others committed their lives to. You all know the recent, completely undeserved attacks that Dr. Fauci has suffered, including in a recent congressional hearing. This is not the night for that. They have had their microphones. They will not be heard here. This hour is for you to finally really meet the man behind the title, the man behind all that wise medical advice that he has delivered to all of us for decades. That man's compassion and commitment and wisdom fill the pages of his new book that is about his own love story with his wife and family, his scientific detective work that is full of suspense and drama and actually lets you feel like you understand the medicine as you're reading it. And you do, but don't try to repeat it to anyone, as I've tried to. And also, this book is full of Dr. Fauci's steadiness and reliability under pressure. The bedside manner that this country has always needed in a public health crisis. That is the story told in this book. And I invite you tonight here to meet Anthony Fauci.